Tonight, the mystery at the Kenyatta National Hospital and the controversy surrounding the suspension of the chief executive officer deepens as those in the know say what's out in the public barely scratches the surface of the problems at the largest referral hospital.
They say the failures at the hospital are systemic and sending away our CEO will not solve them. They, however, believe leadership and political interference is at the center of it all.
And as Ken Mijungu now reports, the more things change, the more they remain the same.
Days of defending the besieged Kenyatta National Hospital Chief Executive Officer Lilian Koros and issuance of ultimatums boils down to questions such as why now and what's ailing what should be the largest referral health facility in the country. The answer is within the corridors of the hospital, now dogged with controversy after controversy. This year alone, 4 incidents that caused public outcry, but only one that got Koros suspended from the office and in quick succession replaced by one Thomas Mutie. Leadership wrangles is right in the middle of it all. Appointment of the chief executive officer is largely political, and even though those qualified are many, only the politically correct can succeed.
The system has very bad cultural practices, some that are very colonial, that are outdated, that are unwanted, that are unneeded. But the system is captured.
The first major scandal to hit the hospital this year was claims that nursing mothers fell victim of rapists who took advantage of the distance between the wards and the newborn unit. The second scandal involved theft of a baby, while the current one touches on the core mandate of the hospital, a surgery undertaken on the wrong patient. Then there was also the incident of broken down machines used to diagnose, leaving doctors with limited options.
The capacity of KNH as it is way below the numbers that are coming in. When this hospital was initially built, it was to handle about 1,200 patients per day. Today, there are more patients, so to the tune of 30,000 coming in today, per day. If we cannot expand, then more problems are meant to come.
The Kenyatta National Hospital is now on the spot. According to medical practitioners, there is more. Aside from the political back and forth, at the center of it all are cartels who seek to control the hospital and the massive fundings that go into its day-to-day running. Oma Oluga, one of the doctors' union officials and a medical practitioner, puts KNH's problem on several levels. Key is political interference.
The same politicians sensationalizing issues are the same problems at Kenyatta National Hospital.
Then there is the issue of staffing. This being the largest referral hospital, one will expect adequate staff to take care of the thousands of patients who seek services here. The doctors say matching the patients' numbers to the caregivers is a long shot.
The workers who are there are also working under difficult circumstances. For example, in the department of neurosurgery, the residents who are there, who are the first contact of neurosurgery patients, are 3 who operate in the whole of the hospital.
The facilities, too, are inadequate. It is expected that such a hospital should have about 40 surgical rooms. KNH has only 12 that are booked all year round. In fact, patients seeking surgeries are put on a 2-week waiting list, and most of them succumb before they are attended to. But the politicians believe this is a well-calculated move for cartels to take over the running of the facility in readiness for the lucrative tenders that come with the 20 billion shilling funding that is earmarked for the hospital. That aside, the Kenya Medical Practitioners and Dentists Board and the Nursing Council believe Kenyatta Hospital should be relooked at if it has to live up to its name and calling. Ken Mijungu, NTV.